I'm going to be showing you how to perform a basic PNF assisted stretching on the extensor chain of the hip. For the first one, what I'm going to do is focus just on the hip. So we are going to perform the stretch with the knee flexed. By keeping the knee flexed, we are taking out any of the muscles that cross the knee and focusing just on the muscles that cross the hip. So for the proprioceptive neuromuscular facilitated stretching, there are going to be two versions I'm going to be showing you. One is contract relax, the second is going to be contract relax agonist contraction. For the contract relax, you are going to have the client push into your arm while you are taking them into the stretch, and then they are going to relax and you will take them deeper into the stretch. For the contract relax agonist contraction, you will take them into the stretch, they will press against you, and then once they relax, they are going to assist you in taking them further into the stretch. So if you are stretching the extensors, they are going to activate the flexors by bringing the knee towards the chest. So I'll show you right now what I mean. So right now we are going to stretch the extensor chain. So we are going to take the hip into flexion, which will stretch the extensors. Then I'm going to tap twice. That's going to signal her to push into my hand. You're going to do that for 4 to 7 seconds. Then another tap, she's going to relax, and I will go deeper into the stretch. That was contract relax. Now for contract relax agonist contraction, 2 taps, so she's going to push in, hold that for 4 to 7 seconds. And this time when she relaxes, she's going to bring her knee towards her chest, so she's going to assist me in taking her into a deeper stretch. When you're performing any of these stretches, you can also play around with the different angles. So if you're just going straight ahead, you are going to be working on all the middle fibers. If you take the leg to the outside, you are going to be working on the fibers that are more medial on the hip. If you take the leg to the inside, you're going to be targeting more of the lateral fibers on the hip. So you can apply the same principle with that. When you are performing the contract relax, you can take them into a little bit of abduction, then have them go into adduction and press into the hand as well, and relax. And for stretching more of the lateral fibers, what you would do is take them into flexion and adduction, and then that'll target more of the lateral fibers. Once we have performed that, next we are going to work on muscles that cross the knee as well. So for that stretch right over there, that's going to focus just on the muscles that cross the hip, like the gluteus maximus muscle. When we have the legs straight, now, aside from the gluteus maximus, we're also going to be targeting the semimembranosus, the semitendinosus, and the biceps femoris. So what we want to do for this one is, with the knee straight, we are going to take the client as far as they can. Once they can't go any farther, you're going to give a couple taps. They will apply some pressure for 4 to 7 seconds, and then relax. And then just like the last one, if you want to do a contract relax agonist contraction, you can give a little tap, they will push into you, 4 to 7 seconds, and then they will assist by bringing the hip into flexion, so bringing the leg towards your head. And just like earlier with the hip, with this one we can also play around with the angles. So aside from working on the middle fibers, if we take them into adduction, we will be targeting more of the lateral fibers, and if we take them into abduction, we will be targeting more of the medial fibers. And that is it for today's video on PNF stretching of the extensor chain of the hip.